So in terms of our results, so we had 2,150 smokers who were eligible to see our smoking cessation practitioner. Of those, 89% agreed to the first consultation with our advisor, and of those, 84% agreed to ongoing support, which is fantastic. We then looked at who was eligible who consented for the study. So we had 1,003 participants. Approximately 47% went into our usual care arm and 53% went into our intervention arm. So before I get into the study results, we did look at our quit rates for the first 4 weeks, just purely looking at this co-located service. We had a quit rate of 16.5%. In those who were willing to receive ongoing support as a validated figure, and that increased to 20% if we use self-reported figures. And our cost per quitter was, I'm just trying to remember off the top of my head, it was around £450, somewhere around there. So in our study intervention, so our intervention group, we had a quit rate of 33.6% in our intervention arm and 30% in our usual care arm. And that was at 7-day validated point prevalent abstinence 3 months after the lung health check. So there was no significant difference between the groups. And then when we looked at our self-reported figures at 3 months and then validated and self-reported figures at 12 months, again, there was no significant difference. But the really important finding is that we found that quit rates at 12 months were largely maintained. So looking at 28–29%. And what we know is that if people quit for 12 months, that's a really good indicator that they're going to carry on being quit for a long time in the future. It's not a short-term reaction to having been in the lung cancer screening programme. So then also within our primary outcome, we looked at various demographic data to see if there was any effect. And what we found is a significant interaction with gender. So there was not much difference in the males, but females were significantly more likely to have quit smoking if they received our intervention than if they were in the usual care arm. There was some interaction according to deprivation group, but there was no kind of individual difference between those. And at 12 months we saw the same gender effect persevering, but the deprivation had disappeared. So everyone that was eligible was age 55 and above, but we did look at age bands, but there was no significant difference or interaction when we looked at age.